I feel very lucky, I'm honored and privileged to be the first one to officially congratulate Chris and Pat. Let's give them a big applause. This is an official applause. Thank you. Thank you. And also to your co-workers around the world. On behalf of all of us, we congratulate them for the wonderful work they have done. It's not easy to get here to get this medal. I was on the jury board for 8 years. I know how difficult it is. Choice is so difficult. And making it really means something. Makes it very distinguished, what you have achieved. It inspires many, many people. You are seen in a very different way after you receive this honor, because everybody else wants to learn. They knew it, but they will see it very differently now, because you have been put in the pedestal. That something not just in Seattle, it's all over the world. I know you, Chris, for a long time, and I have been a great admirer of you because a lot of things we are trying to do in Bangladesh, you have already done in a big way in many different countries. So we're trying to pick it up, how we can benefit from that. Health is a problem everywhere, but it's a special problem in Bangladesh, where the service is totally absent. You build a whole machinery because health is supposed to be a government-delivered service. When you don't have an efficient machine, efficient government, you run into problem in such cases. You build the machine, you spend a lot of money to run the machine, and at the end of the day, you find out all the money is used just to keep the machine there rather than deliver the service. So we see it very much in Bangladesh, similar way. And the poor, and particularly bottom half of the population, they are the one who miss out from everything as a health service. Then you encourage the private sector to get into it because it's unmet demand. People are going to Singapore, people are going to India, people are going to Bangkok for simple things, because they can afford it for the treatment. So there are a lot of people who cannot do that. So the private sector got in, built up facilities for them. But they did a good job. But at the same time, they're serving the people at the top. They're not getting to the poor people either. So this is another big issue, that how do you address the poor people in the health service? While I'm complaining about all this, I should mention that Bangladesh has done wonderful in health area as a nation. On the health indicators, Bangladesh was the lowest country within the South Asian region. We are below India, below Pakistan, below Nepal, below Sri Lanka. But as days went by, Bangladesh gradually started overtaking one country after another. And then, by now, it has surpassed all the countries in the region, India, Pakistan, Sri Lanka, and so on, in health indicators. So this is a great achievement for Bangladesh to move so fast in achieving that. And if you look for Millennium Development Goals, Bangladesh, again, is a country where they can take pride that they are on the track in achieving the Millennium Development Goals, particularly Millennium Development Goal number 1, reducing poverty by half by 2015. Despite all the shocks and all the troubles we have, all the cyclones, all the floods, and all the financial crisis, all the political turmoil, we're still on the track in achieving Millennium Development Goal number 1. And we expect to achieve all the 8 Millennium Development Goals by 2015. So this is no small thing for Bangladesh to achieve. But we are slightly behind the schedule on maternal deaths and infant deaths. So this is the focus that we are trying to pay attention to, that can we lift it a little bit so that we can have all 8 Millennium Development Goals done by 2015. So in that, one big contributing factor was the empowerment of women in Bangladesh. And that has impacted in many, many areas, including birth rate, population growth rate. The number of children per family used to be 6.1 per mother. Now that has come down to 3 per mother, so which is quite a difference in last 25 years. So we see a lot of dynamism in the health sector to be built on this experience that we have in the past, how to build it up together. And from our side, the one that we are involved in, microcredit, soon got involved with health issues because poverty and health are not too far distant issues. If you are poor, by definition, you are poor in health. So it has to go together. If you are trying to get you out of poverty, you have to get out of poverty along with the health improvements in that. So we got involved with that in sanitation and tube well water, in vegetables, nutrition, and so on and so forth. But the way we reacted, I should mention, today you mentioned PATH was established or began in 1977. 76 and 77 seemed like magic years because we were born in 1976. So a lot of things happened since then. The way I reacted to the problems we saw, whenever we saw a problem that we have to handle, somehow, without knowing what I'm doing, I always try to answer that, or I'll try to find a solution by creating a business out of it. So everything I did, you mentioned 30 companies or more, every one of them was addressed to a particular problem. The reason we created the Grameen phone, the mobile phone company, which later became the largest telephone company in the country, which still is the largest company in the country, was to bring information technology to the poorest people. And that's why the famous telephone ladies came into the picture, and that became a big thing in all telecommunication business. And today, this is healthcare to be not looked at the same old way that we did 30 years back, because the world has changed so dramatically in the last 30 years. Even if you look at the last 10 years, it's dramatic. In 1997 in Bangladesh, there was only 500,000 telephones in the whole country. Today, nearly 50 million telephones all over the country, and it's growing. So telephone is something everywhere. Even very low-income people have phones. So with a population of 150 million people, having 50 million subscribers, on average, 3 people have one phone. So every single family has a phone. This is a very powerful instrument. You can bring anything you want with this mobile phone. So we have to look at healthcare, at least that's what we are trying to do, through the mobile phones, how we use this. So we started doing things with the mobile phones and other things that we have done. And that is in the meantime, as I said, we create companies, then we started giving a specific structure of that company and started calling them social business and calling them non-loss, non-dividend company to solve a social problem. So we tried to stay away from dependence on repeated donor money. So if you start the company, it should run by itself. So everything we did in the healthcare, in other sectors, we tried to do that. It has to be self-reliant company. Otherwise, you have no solution. You remain dependent. So we used this idea in the healthcare. And the first one we did, still we are not sure whether we can be successful in healthcare and social business, but we went ahead, created an eye care hospital, because there are so many cataract patients in Bangladesh, so we wanted to concentrate on the cataract. And the new cataract patients are so much. The entire capacity of Bangladesh, if you had treated the new cataract patients, still we cannot finish the new one. In the meantime, you increase the number of the backlogs. So the whole backlogs are increasing. So what we have done, we said this is our first hospital with a capacity of 10,000 cataract operations per year. And if this one works out as a social business, we can see that we have succeeded, and we'll have the second one, the third one, and the fourth one. Because if it's a social business, then you have no problem, because it runs by itself. So first one we did, and now it's self-reliant. Its operational cost is already covered. Now we are going for the economic self-sufficiency. So this is okay. We see we had a lot of problems along the way. We don't have the doctors. We can't send the doctors to the villages, but still we made it. The second one just started. We constructed the second eye care hospital, and now getting ready for the third one, because if it works by itself, what is the problem? You can treat as many patients as you want. In the meantime, you're improving the efficiency, you are taking care of the patients. So we're adding, along with cataract, other eye-related problems into the hospital. So this is one series, and we felt very good about that. Then came the Danone case. By accidental factors, I met the chairman of Danone Group, Frank Gibault. And during the discussion, I proposed that why don't we create a social business on yogurt? And this is the beginning, 2 years back, and finally he agreed right away. So we created that company to bring nutrition to the children. This yogurt is a fortified yogurt. We put all the micronutrients missing in the children into the yogurt. When I say nutrition in Bangladesh, it's not a tiny issue in healthcare. It's a big issue in healthcare, because almost half of the children in Bangladesh are malnourished. And if you take half of that half, severely malnourished. So if you cannot build a health system leaving the children malnourished, they are the ones who will become victims of all kinds of diseases. So we have to address that. So we thought, since we found Danone to agree with that, let's do that. So when we built a small plant to produce yogurt with the micronutrients, we were not sure whether we will be able to do it or not successfully. Now, it's operationally is coming very close to operational self-sufficiency, and we are getting ready for the second plant. I'm sure second plant will be much efficient than the first plant, because we didn't know anything about producing yogurt, selling yogurt. Now we know a lot of things. The second one will be better. Third one will be still better. We would have at least 50 plants all over Bangladesh as a social business. Another issue that we have addressed is the water. You know Bangladeshi water situation. As I said, Bangladesh has 150 million people. Half the population of Bangladesh drink arsenic-contaminated water. And in some of the cases, it's extremely high level of arsenic contamination. People literally drink poison every day without knowing what they're drinking. Some casually say, oh, we know, but what can you do? This is the water we have. Very casually, because you don't see anything. It's such a nice water, but it has arsenic in it. Government tried to paint red mark on all the tube wells, which is producing beyond the limit acceptable for human consumption. Nobody cares. So we have no solution. So we joined hands, another company, Veolia, which is one of the largest water company in the world, a French company, to create a small water treatment plant in the village to sell clean water in the village. So you have the very clean Veolia quality water in the village for a tiny little payment, so that you can have safe drinking water. If this one works out, then again we keep on repeating this. Investment is very clear amount, in how many years you can pay back the investment money, because in social business, investor gets back the money. You still own the company, but the company runs by its own income. So this is the idea of social business. And we entered into another area. Again, another company came forward, and we thought it's a great idea. BASF from Germany. The president of BASF, Dr. Humbrecht, he took personal interest in the idea of social business. So, can we do some social business with you? I said, of course we can do it. Two things came out of it. One is nutrition, making sachet of 15 nutrients in little tiny sachet, make it very cheap, because in social business you can get as low as possible, and then make it as a sprinkle for food or anything. So this is our first one. Many other items will be coming in that direction. So the plant being under construction now to produce that micronutrients. Another one is bed nets, because Bangladesh has pockets of malaria, but more than that, Bangladesh everywhere is lots of mosquitoes. Even to have a peaceful sleep, you need something to cover yourself with a net. So this came on great idea. I said, why don't we use the bed nets? Because BASF has the patent on the bed nets. So now we are setting up a plant to produce bed nets so that we can give bed nets, or sell bed nets to everybody and make it very cheap, affordable. And those poor people who cannot afford it, we'll give them the loan. Grameen Bank has the credit facility, so you buy a net on a credit. So gradually you pay back and save your children from dengue, from malaria, every mosquito-borne diseases that you can have. And people love it. We have experimented with the already manufactured bed nets to see what would be the reaction. People love that. That seeing the mosquitoes don't come anywhere near them. It's something. They use mosquito coils. Something, fumes come into you, you breathe it all the night, and everything is closed, particularly in winter, and you continuously breathe this fume coming out of that, and it's a health hazard. But they make a lot of money, those who are selling coils. And they love mosquitoes because it brings them millions of dollars worth of profit. So this is no solution at all. It's a very difficult thing to do. So every single thing that we want to do is a kind of design a social business out of it and so on. And I'm very happy that the response I get from health people, and I'm getting a lot of response from the USA. Many companies like Pfizer, like Johnson & Johnson, General Electric, they are collaborating with us, building up village-level structures. Because we have tried in the past to bring healthcare at the village level by setting up clinics. We did well as a social business, but that was the problem came because doctors don't want to stay in the village. So now we're redesigning the whole thing. We're saying now we are redesigning it what we call social health management center. The objective of the health management center will be to keep healthy people healthy. That's our number one. And number two will be early detection. If somebody deviates from health situation, then immediately should be detected. And then early treatment so that you don't go too far. And on the population side, we're focusing on women, number one priority, children, number two priority, and adolescent girl, number three priority. Because these are the most difficult segment of population to reach. So we thought if you can do that, we can solve all the problem. What we are doing, instead of asking the doctors to come, we are bringing the technology to take place. We are working with the General Electric. They are very helpful with us to design new diagnostic equipment, very simple, which will be hand-carried, house to house, rather than patients or pregnant mothers coming to the clinics, which is very difficult for them. They don't want to do that. So the girls will go around in the house to house, talk to the people, and carry these equipments and do this thing. And this will be connected with mobile phones, transmit all the images, all the information to the doctors, the specialist doctors sitting in Dhaka, so that they can see it in the screen at the same time, talk to the patient on the mobile phone. Somebody who is delivering the service there, she will be the intermediary between the doctor and the patient so that they can carry out the. This is the idea that we want to carry out. And another social business company that we created in collaboration with Intel Corporation, so the Grameen Intel, they're already using the mobile phone to screen the risky pregnancies, because as I said, we have to bring it down because that's where we are deviating from the path to the 2015 goal. So we are concentrating on that so that we can reduce the maternal mortality to the lowest possible, even way below the target that we fixed in 2015. So they have software, they have this question, about 32 questions, which are fed into the mobile phone, answers from the pregnant mothers. Analyzing these questions, they can classify the status of the pregnancy of the mother, whether it's a risky pregnancy, whether it's an average, whether it's a normal, whatever it is. So this is another one that we are using mobile phones for. So we see mobile phones and the technology and the fact that we have outreach, we have the network, we can create the network and do it in a business way. I think we can change the whole situation of the picture that we have in addressing this issue. So we are creating new social businesses and creating nursing colleges. Nurse is a rare commodity, rare persons in Bangladesh. For every 3 doctors, we have 1 nurse in Bangladesh. So you can imagine what the problem is in our health sector. So we thought, why don't we take the Grameen borrowers' daughters who have been now in education, they have graduated from high school, and then get married and have children. That's it. There's nothing else to do. I said, why don't we pick them up and train them as good nurses and fill this gap? And there's international demand for nurses, and we can fill that international nurse gap too. And they become professional young people. So this is a tremendous change in the status of women and so on. And we're very happy that many universities have been supporting us, like Glasgow Caledonian University. The first nursing college will be built with the collaboration of Glasgow Caledonian, and Nike Foundation is investing in it. And then each one will be a social business. They have to cover their cost and continue expanding with their own money. And then the third one, and second one, and the third one will be coming up, and Emory University is coming up to support us in the second one with their technology, with their experience. And we are, in the meantime, talking to other universities. UPenn has been very, very supportive. They are coming next month to elaborately discuss the details. And Harvard University, Johns Hopkins, and so on. So see how we can connect the village level thing with the city level technicians and professionals and address the health issue in a completely different way than we did in the past. So this is a basic thing will be how to design it in a way it runs as a social business, non-loss, non-dividend company to solve a social issue. In this case, these are health issues. Each one is a separate piece. So we are not putting everything in under one company. Each one is a separate company. It succeeds, it goes up. If it fails, it goes down. We build another one to replace it so that we know exactly what is happening. And lots of new issues come up along the way. About 3 days back, I got an email from Japan. This is also something very close to our heart in terms of social business. He's a rich businessman in Japan. He somehow became very excited about the idea of social business. So he came to Bangladesh and discussed with us, went back, and I got a few mails. And the last one is, he raised this issue, and this is an issue that I would like to share with you. I've already responded to it. I'll tell you how I responded. He said, you know, something you tell me about this, how to solve the social issues, and I was thinking about it. You talked about homeless people. Yes, this is one issue. We can solve it with the social business. But to me, a more important issue in Japan, more than the homeless people, is the suicide. He said 30,000 people commit suicide every year. And now with the financial crisis, that number is increasing. They commit suicide because they lost job. And one thing they do, they jump in front of the train, they hang themselves, they use all kinds of methods to commit suicide. 30,000 a year, nearly 3,000 a month committing suicide. He said, yes, we would like to have a social business. I said, yes, it can be done. We can do that. I gave him some suggestions. Let's do it. He said, we can save one life by this social business. That's worth having that social business. And if you knew how to save one life, we found the solution to 30,000 lives. because you have developed the seed. In social business, most important thing is this developing the seed. Once you develop the seed, all you need to do is to replicate it. If you have one yogurt plant successfully working, covering all the cost, your problem is solved. You go on expanding it, you repeat it, and it will be done. Nutrition will be delivered. So this is one nutrition. Sachet is another nutrition. Shaklee is coming to set up. Shaklee is an American company. They are coming up to do a social business with us in Bangladesh to see how this can be done too. So this is another one. So many ways, because there's a tremendous technology today which didn't exist yesterday. So we should be looking at the healthcare completely different way, because we are in command of this technology. Only thing, this technology is in the command of businesses, where they make use of this technology to make money. So that way they are not into the thing that we are looking to. So if you can open a door so that this technology can also be used to solve the problems in a social business way, all these problems can be removed completely. So that's where our creativity comes in. That's where the young people's creativity comes in. That's where the company creativity comes in, because they know how to use this technology for that particular purpose. Once they open up the door, yes, we would like to have a social business and go on with it. So this is the challenge for us. This is 2009. By 2015, we must conquer this whole healthcare issue. We have to come out of it, because we have come a long way. We can't go on that, okay, mothers die, what can you do? Okay, children die, what can you do? We can do a lot. One individual can do a lot, change the whole world. That's the challenge you bring to us. Thank you very much.